Hi, everyone, and welcome from down south in Louisiana. Jim Bartles here from the American Farm Bureau National Convention. It's a centennial celebration this year. As we record this, we just came off of the opening general session, and Ruth Meirick is my guest. She's a part of the Minnesota Farm Bureau staff. And Ruth, first, I welcome you to the broadcast that we have. That was an impressive presentation. Zippy Duval, we had a couple of U.S. senators who were there, and of course, the production involved. It's impressive.
It is, and President Duval always does a fantastic job talking about our past year and this year with the centennial, talking about the past 100 years, and as we're moving forward into the next century with Farm Bureau. Really a lot of enthusiasm in the audience, and just so proud to be a Farm Bureau member and actually be able to work for them.
You're going to be involved in a pretty special event going on here at the convention. Update our listeners and viewers as to your involvement here.
Well, I'll be doing a presentation later today on the opioid crisis facing rural America. We have a deep concern about the opioid use in our rural communities. We see it as Farm Bureau a safety concern. We want to make sure that our families are safe and healthy back home. And so the American Farm Bureau has asked me to come in and talk about that a little bit to the audience here about what we've done in Minnesota to help curtail that.
Farm Town Strong, right? Is that kind of the umbrella title for this?
It is. So farmtownstrong.org is a website that the American Farm Bureau and National Farmers Union set up to really bring information to individuals out in our rural communities across the nation about the opioid epidemic. What farmers and ranchers have said, and based on a Morning Consult survey done by the American Farm Bureau, is that by reducing stigma, by bringing resources to rural America, we can actually help the opioid epidemic. People don't realize that the opioid epidemic, the numbers have surpassed the urban areas as far as opiate overdoses. And that's one of the things that we need to be talking about and being at the table and having those one-on-one conversations with farmers and ranchers across Minnesota as well as the nation.
So if someone would come to this presentation or happen to see it or hear it some other place, what's some of the main message points that they're going to get that they would walk away with?
So what they're going to get is they're going to get information on the website, how to access it, resources. Where the website actually talks about where they can go to recovery centers. 1 out of 3 farmers feel that they can't access a recovery center, and that's a huge problem in our areas. They have to drive many hours to find a place where they can get some help. They're also going to see what we're doing in Minnesota, how we put a program together, how we're at the table visiting with people from the Department of Health, Association of Minnesota Counties, law enforcement, health officials, recovery center people, how we're having the conversations. What I noticed, I spoke at the Association of Minnesota Counties, and out of 250 people, 4 people raised their hand that were involved in agriculture. To me, that's a problem because we know that the opioid epidemic, the crisis is happening in rural America, and if we're not involved, or we're not having the conversation, and we're not involved, then we're not doing anything for our farms back home and our people involved in farming and ranching. So the other thing that it talks about all of the statistical information that was gathered from the survey that the American Farm Bureau did. And a couple of those points that I want to bring out is that 3 out of 4 farmers can access opioids without a prescription, and also that I already talked about the access to recovery centers, and then the 3 out of 4 farmers also feel that we can reduce the opioid crisis through the resources and reducing stigma, like I talked about before. There's lots of information that's in that website that I think is useful. It really tells us that we have a problem that we need to work on. So, that's going to be a part of my presentation, but really talking about the farmtownstrong.org website.
All right, so I was just going to ask again, we're talking with Ruth Meirick. Ruth, of course, from Minnesota Farm Bureau office. So website, if people want to go to that, the website is, the address?
Farmtownstrong.org website for the access to that website. And then the Minnesota Farm Bureau is mnfb.org.
So again, farmtownstrong.org.
It's actually, yes, and I'm sorry, I said the Farm Bureau website is fbmn.org. I also want to bring attention to the fact that we also have people that are disposing of prescription medicines wrong. And I will be talking about that, about the safe disposal of our prescription drugs. Many people leave their prescription drugs in their medicine cabinets or in places back home. In that I tell people that, quite honestly, you're contributing to the opioid epidemic if you do that. You put yourself at risk for people stealing those prescriptions, rural crime. So we need to get those out. We need to dispose of them properly. We've been handing out 10,000 doTERRA drug kits across the state of Minnesota. It's a deactivation kit. It's charcoal-based. The product's actually made in the great state of Minnesota. But we're also promoting National Take Back Day and the safe way to dispose of prescription drugs.
If someone would like to have this presentation come out to them, is this something that can be done by appointment or not?
Absolutely. They can reach out to me at Farm Bureau. I am more than happy to go out and give presentations. We've done a couple in a couple counties already, involved lots of community leaders, which have been very, very proactive, very educational. We're learning things from them, and they're learning things from us, so great exchange of information. And then also, like I said, we've been working with county health departments, county commissioners, just talking about the issue. If we don't know about it and we don't know how bad the crisis really is, then people sometimes just sort of sit back and watch. I want to make the point that in 2017, 70,000 opiate overdoses happened across the United States. If you think about the Vietnam War, 58,000 people were killed in the world in Vietnam War. In 2016, 50,000 people died of the opiate epidemic. So from 2016 to 2017, we've increased that number by 20,000. So we absolutely have an epidemic. We absolutely need to be having conversations. And farmers and ranch families across the United States need to be working within their county farm bureaus, within their civic organizations, within their communities, having conversations on how they can help this epidemic.
A lot of good material. Ruth Meirick, we appreciate it. Thanks for your work on this. Enjoy the presentation later on today, again, as we're recording this on Sunday. And thank you for your work on behalf of the farmers and Farm Bureau members. And what a great cause here. Again, farmtownstrong.org, correct?
Yes, that's correct. And thank you very much for just letting me have the opportunity to talk more about this issue.
From Louisiana and New Orleans. I'm pronouncing it correct because they said it's New Orleans, not New Orleans down here. This is Jim Bartles. We're coming your way on the Ingstead, Minnesota Radio Network.